Hi, this is Dr. Greg Scott, and I just have a short video here trying to answer the question of supplement quality. There's a lot of supplements out there, and so how do we know which ones are the good ones to buy and which ones we should pass on? And there's a lot of mystery with this, and a lot of people don't know where to go just because there's so many choices out there. Oftentimes when I give health talks, this is one of the questions that I get, and I know from experience talking to prescribing physicians that this is one of their major concerns with it as well. They may be more prone to recommend supplements if they know that the quality is high, and they may be more likely to shoot them down if they're unsure about the quality because they know with their pharmaceutical drugs that the quality is very high because that's regulated very highly by the Food and Drug Administration or the FDA. So how do we determine what's good and bad? I think first what we want to do is kind of understand where we're at and how we got there. And how we got there was through the DSHEA, an act that came into place in 1994, Dietary Supplement Health and Education Act. And basically what happened with this is that supplements were legally defined as food by the FDA. The FDA claims no jurisdiction over foods, and so therefore they claim no jurisdiction over any supplements. They're not going to evaluate supplements because it's not part of their job, according to this law that was passed. So this is why when you look on supplements and maybe some other products, you'll see this product has not been evaluated by the FDA, blah, 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 whatever it says. It's also the reason why with certain foods out there, they may call them low fat or high fiber, may help to reduce the risk of cardiovascular disease. It's all legal terms that companies are allowed to use because they meet a particular standard that's been defined in this act. As a consequence of the DSHEA, this has led to a lot of companies out there that are completely unregulated by government agencies. The FDA will only look into a company making a supplement if it's painfully obvious that they are hurting people. In the late 90s, there was companies out there making a product called Fen as a weight loss, which it did work for, but it also caused acute heart failure, and so it was killing people. And so the FDA came in and shut all of that down. So ultimately, as a result of the DSHEA, it's up to individual companies to provide quality control. Basically, them being honest, saying, yes, we promise that our product has good quality. And as a result, there's a high diversity of quality out there. Companies that are just looking to make a quick buck, especially if somebody big in medicine may promote a particular type of supplement, they may go out and say, oh yeah, we've got one and it's a low price to get it here, kind of thing. And then you've got companies that their main focus is to produce high quality products. And so that's kind of how we got here. And so to kind of start this off, I'm going to basically divide into about 4 different groups the type of supplements out there, starting with agricultural grade supplements, and give them an academic grade. So the agricultural grade supplements are grades D to F. They're terrible. They're not really intended for human use, only for animals. And so the moral here is don't eat your pet's vitamins. Most people aren't doing that, and this really isn't an issue. It's not what we're most concerned with. In the second group, nutritional grade supplements, this is more what we're concerned with. Academic grade, I'll say C. Unfortunately, this is the most common of all supplements. Most common of all supplements are not all that high quality. So this is where you're going to see these supplements sold in places like Walmart, Target, CVS, Walgreens, and maybe even found in health food stores, quote unquote. The reason why I'm rating them poorly is because they're rarely tested for absorption, basically how well can you absorb those vitamins, and they're not tested very often for purity. And what that means is that even though it may say it has 500% your daily value of this vitamin or whatever, it may not be entirely accurate. On top of that, it may just essentially pass through you and never be absorbed at all. So just an example to kind of illustrate this was from February of 2015. This is a copy of an article found in the New York Times titled "What's in Those Supplements?" And there was a big outrage because some independent individuals did some studies at Target and I think CVS or Walgreens and a couple other companies out there that sold these really relatively cheap vitamins. And what they did, looking at Saw Palmetto and I think St. John's wort, they did some analysis of those supplements and found that in fact the saw palmetto supplements didn't contain saw palmetto, and in fact they did contain other contaminants that were probably harmful for somebody's health. And so this is the kind of thing that you're going to tend to get from those types of stores, and there's really, you just kind of left to the goodwill of the companies that make them, to be honest, and hope that they are actually something good. So these are probably not ones that we want to buy if we're looking for quality supplements. Medical grade vitamins, I'm going to give them a B to a C. They're a lot better. Most prenatal vitamins are going to fall into this category. It's more important. These vitamins tend to have some level of quality control. Our main levels of quality control are going to be good manufacturing processes, GMP or NSF certification, and you would find that kind of information printed very clearly on the bottle itself. You may find some of these supplements in the same place you would find nutritional grade supplements. So every once in a while you might find some good stuff at Target or some of those health food stores. What I like to do when I'm looking for medical grade or medical quality supplements is I use Emerson Ecologics. They will also sell pharmaceutical grade, which is going to be our highest grade of vitamin, but they tend to use like the stamp, like a gold stamp or a silver stamp to verify the quality of the product, where gold stamp would be the highest quality and silver stamp would indicate a pretty good quality. So that's a good option for people. Our highest grade is going to be the pharmaceutical grade. I'm giving them a grade A or B, depending on the company. And what I mean by pharmaceutical grade is that basically the same standards of purity and absorption are used that are used to make pharmaceutical drugs are used to make vitamins. And these are companies that have the highest quality. They'll usually have some sort of third-party verification. Typically, these are only sold by licensed healthcare providers such as medical doctors, DO, DC, nurse practitioners, or possibly some pharmacists out there. So they can be a little bit harder to get a hold of, but as far as quality goes, these are the highest grade. The companies that I tend to use, the companies that I like, Metagenics is probably my number one, and then followed closely by Biotics, and then Apex Energetics, Orthomolecular, Thorne, Integrative Therapeutics. Basically, all of those there are going to be, these companies want you to work with a healthcare provider. And I think that's an important point to kind of end on here, is that if you're just taking a supplement, like a multivitamin or something like that, get a high-quality multivitamin, and you're okay with that. But, if you're trying to work through a healthcare problem that you have, please work with a qualified healthcare provider for best results, because you may need to consider other things that are going on, and maybe drug-drug interactions. You can find qualified doctors like myself at functionalmedicinedoctors.com. Just type in your zip code and it'll give you a qualified functional medicine provider in your area. So hopefully that answers your questions. If you have any further questions, just don't hesitate to give me a call. Dr. Big Scott. Phone number here is 913-701-6708. Thanks for listening.